John with the Health Education Program over at Kaiser. And thanks again, everyone, for participating in today's presentation on Medicare and COVID-19, presented to you by the State Health Insurance Assistance Program. I'd like to introduce Candice Young from SHIP and her staff that will be doing the presentation. So Candice, go ahead and take it away.
Thank you, John. Whitney, are you ready to present?
Yes, I'm ready.
Okay,
so hello everyone, and thank you for joining us today. My name is Whitney, and we also have Jan and Isaac. We are SHIP volunteers, and today we'll be discussing Medicare and COVID-19. Next slide, please. A little information about the Hawaii SHIP program. SHIP is an abbreviation for the State Health Insurance Assistance Program. We are a federally funded program focusing on helping individuals with questions regarding Medicare. We are administered by the State of Hawaii Department of Health, and we are located in the Executive Office on Aging. Hawaii SHIP is a volunteer-based program providing free, local, unbiased Medicare information, assistance, and referrals over the phone or in person. We offer free Medicare presentations, such as this one, to the public, as well as participate in fairs and exhibits. If you know of anyone who might be interested in a presentation or counseling, you can please call us at the number at the bottom of the screen, 808-586-7299, or visit our website at www.hawaiiship.org. Next slide, please. So before we discuss Medicare in relation to COVID-19, we would like to do a brief overview of Medicare. The graphic you see here depicts the two Medicare options beneficiaries have. The first option is Original Medicare, which consists of Medicare Part A, hospital insurance, Part B, medical insurance, Part D, prescription drug coverage. There's also an option of adding a Medigap, also known as Medicare supplemental insurance policies, which can help cover additional deductible, co-insurance, and co-payment expenses for Medicare Parts A and B. The second option is a Medicare Advantage plan, also known as Part C. In order to get Part C, you must have Parts A and B. Most Part C plans include a prescription drug rider. Some examples of Part C plans in Hawaii are HMSA, United Healthcare, Kaiser, Aloha Care, Ohana Health Plan, and Humana. Next slide, please. Now that we understand the different parts of Medicare, we'll review the different Medicare enrollment periods. The first enrollment period we'll discuss is the initial enrollment period, also known as IEP. This is a 7-month window where beneficiaries can enroll into Medicare for the first time. Beneficiaries have 3 months before their 65th birthday, the month of their birth, and 3 months after to enroll into Medicare. Next, we see the general enrollment period, also known as GEP, which occurs on January 1st through March 31st of each year. During this time, individuals can enroll into Medicare Parts A and B if they did not enroll during their IEP, and these plans will take effect on July 1st. The special enrollment period, also known as SEP, is given if the individual or their spouse loses their creditable coverage. Creditable means equal to or better coverage than Medicare Parts A and B. If you have an SEP, you will have 8 enroll into Medicare Part B from the moment you lose your creditable coverage, and 63 days to enroll into Medicare Part D from the moment you lose your creditable coverage. An open enrollment period, also known as OEP, occurs from October 15th through December 7th of each year. During this time, beneficiaries can make changes to their existing health coverage, and all changes will take effect on January 1st. Finally, we have the Medicare Advantage Open Enrollment Period, also known as MAOEP, and this is only for those who have Medicare Advantage plans, and occurs from January 1st through March 31st, which allows beneficiaries additional time to make changes to their health coverage. All changes take effect on the first of the following month. Next slide, please. Now that we have conducted a light Medicare review, in our presentation today, we'll be discussing Medicare Part B online enrollment, Medicare coverage of COVID-19, and COVID-19 scams. Next slide, please. The Social Security Administration is now allowing individuals to enroll in Medicare Part B online as of May 26, 2020. Individuals will need to complete forms CMS 40B and CMS L564 to enroll. Individuals should also have their Medicare number, current address and phone number, email address, and documentation verifying their group health plan coverage, such as income tax returns showing health premiums, W-2s reflecting pre-tax medical contributions, and/or pay stubs showing health insurance premium deductions. As a side note, beneficiaries will not have an option to save and revisit their application. We have linked the enrollment slide within this presentation as well. Next slide, please. So next we'll have Jan, who will be discussing Medicare coverage of COVID-19.
John, make sure you're unmuted.
Sorry, that was my big mistake. Good morning, everyone. I'm sorry. So now that we have discussed enrollment and switching health coverage during COVID-19, we will be discussing Medicare covered benefits of COVID-19. Medicare Part B will cover tests related to diagnosing or aiding the diagnosis of COVID-19. Medicare will also pay for some of the tests related to respiratory conditions, such as a flu test, to aid the diagnosis of COVID-19, along with a COVID-19 test. Medicare will also cover COVID-19 antibody tests. Covered test has no out-of-pocket costs included in your Medicare Advantage plans. You can now be tested in your home, a doctor's office, a local pharmacy, a hospital, nursing home, or a drive-through site. Testing does not require a doctor's order. For individuals who are homebound, living in residential nursing homes, Medicare will also pay for trained lab technicians to collect test samples. If you are receiving home health services, your nurse can collect a sample. Next slide, please. Medicare prescription drug plans are required to provide 90-day refills when requested. Ensure beneficiaries have access to cover out-of-network pharmacies, and prescription drugs must waive mail and home delivery limitations and prior authorization. Next slide, please. During this pandemic, Medicare Advantage plans must allow beneficiaries to receive home health care services at out-of-network doctors' offices, hospitals, and other facilities. In addition, Medicare Advantage plans must charge in-network cost sharing amounts for services received out-of-network and must waive any referral requirements. Next slide, please. In terms of telehealth, Medicare will pay for virtual check-ins with your physician or certain practitioners if the virtual visit is not related to a medical visit within the previous 7 days and does not lead to a medical visit. In order to receive virtual check-in, you and your doctor must document consent in your medical record. You are still in charge of the Medicare deductible and co-insurance for these services. For those who do not have access or do not wish to use interactive audio-video technology, audio-only phones are allowed temporarily. Finally, you may use communication technology to have full visits with your doctors. You can get these visits at rural health clinics and federally qualified health clinics. Medicare pays for many medical visits through this telehealth benefit. As a side note, virtual check-ins can be conducted with a broader range of communication methods unlike Medicare telehealth visits, which require audio and visual capabilities for real-time communication. Next slide, please. In regard to skilled nursing facilities, also known as SNF, prior to COVID-19, Medicare required beneficiaries to spend 3 days as a hospital inpatient in order to cover skilled nursing facility care. But during the pandemic, Medicare has removed the 3-day qualifying hospital stay requirement for beneficiaries who experience dislocations related to the public health emergency, which includes, but is not limited to, beneficiaries who need to be transferred to an SNF due to nursing home evacuations or to make room at local hospitals, or need SNF care as a result of the current public health emergency, regardless of whether they were previously in the hospital. As a side note, you do not need to be diagnosed with COVID-19 to qualify for this waiver. Next slide, please. So Medicare Part A covers up to 100 days of skilled nursing facility care for each benefit period. A benefit period measures your use of inpatient hospital and skilled nursing facility services. A benefit period begins the day you are admitted to a hospital as an inpatient or to an SNF, and ends the day you have been out of the hospital or SNF for 60 days in a row. You will pay nothing for days 1 through 20 for each benefit period. Days 21 to 100, you will pay $176 co-insurance per day for each benefit period. And lastly, 101 days and beyond, you will incur all costs. Beneficiaries who are unable to start a new benefit period because of the public health emergency can get 100 additional days of covered SNF care without having to begin a new benefit period. Now, this one requires the patient to be diagnosed with COVID-19 for this waiver. Next slide, please. In terms of home health requirements, during this pandemic, homebound requirement can be met in additional ways if a physician certifies that a patient should not leave their home because they have a medical condition that makes them susceptible to contracting COVID-19, or if they suspect or are confirmed case of COVID-19. And now I'm going to turn it over to Isaac, who will discuss fraud and schemes associated with COVID-19.
Thank you, Jen. Before we move on to the fraud schemes associated with COVID-19, it is important that we cover a few definitions. Fraud is defined as knowingly and willfully executing or attempting to execute a scheme or plot to defraud the Medicare program, or obtaining information by means of false pretenses, deception, or misrepresentation in order to receive inappropriate payment from the Medicare program. Medicare abuse involves a payment for items or services when there is no legal entitlement to that payment, and the provider has knowingly or intentionally misrepresented the factors to obtain payment. Abuse may also be a questionable ongoing pattern when unnecessary charges may not meet professional medical standards. Next slide, please. Some of COVID-19 scams involve offering fake cures, trying to sell ineffective protective gear or unregulated products, pretending to be a medical professional and offering telemedicine, and offering investment opportunities in companies benefiting from COVID-19. Now scammers are pretending to be contact tracers, contacting individuals trying to acquire personal information under the illusion of identifying individuals who came into contact with infected individuals. Next slide, please. You should never give your Medicare number to anyone other than your doctor, healthcare provider, or other trusted representatives. You should be cautious of anyone who comes to your door offering free testing, treatment, or supplies. Do not click on computer website links from sources you don't know, which could put your computer at risk. In the same regard, make sure your device's antivirus software is up to date. You should be cautious of purchasing medical supplies from unverified sources and ignore online offers for vaccinations. If you see advertisements promoting prevention products or cures for COVID-19, they are most likely scams. Also, the Internal Revenue Service recently warned of new text messaging scam that trick people into disclosing bank account information under the guise of receiving the $1,200 economic impact payment. Next slide, please. If you suspect potential fraud, please contact the Senior Medicare Patrol, that's SMP Hawaii, at 808-586-7281 or at their website as noted on this slide. Next slide, please. To contact Hawaii SHIN, you can call our helpline on Oahu at 808-586-7299 or our toll-free number 1-888-875-9229 or by visiting our website as indicated on this slide. Thank you. Next slide. Thank you for listening to today's presentation. Does anyone have any questions or comments?